success I have seen is increasing access to care and resources for individuals who are at risk for complications regarding their lower limb health. These resources include timely access to a healthcare provider, wound care, foot care, supplies such as orthotics, orthopedic shoes, compressions, and diabetes education, all of which help improve outcomes of their lower limb health.
So this initiative has really strengthened our relationships and collaboration among healthcare partners, but also with housing and social services. In particular, we've implemented integrated pathways for lower limb care for homeless and unattached patients, which is great. But even more amazing in doing this is how we've been able to mobilize around individuals with complex needs with case conferencing to develop plans to address clients' overall health and psychosocial needs when they're in crisis. This level of collaboration has been a huge win, specifically with being able to support individuals with being discharged in an expeditious way from acute care, as well as just avoiding emergency department visits.
The lower limb preservation strategy has evolved slowly by gradual scaling of our pathways and to new partners and new client populations. This has meant we can balance our approach, focusing on both at-risk patients or homeless populations and those individuals who have certain risks, such as diabetes or vascular disease. Our continuum of care now includes patients with acute needs, but also with those individuals who have self-management and provincial goals in mind.
Yet effective win in the rollout of our initiative has been supplying our partner shelter agencies with wound care supplies. LLPS clients, unfortunately, a lot of the folks that we're serving in the homeless population aren't able to engage in healthcare in a structured way. So having our partners across the city equipped to support their clients either before they engage with us in our clinic or during their plan of care with appropriate wound care supplies really minimizes risks of worsening and furthering complications with wounds. And I personally have had the pleasure of delivering these supplies to these agencies, and it was a treat to see the faces of individuals and receive thanks where they really struggle on a day-to-day basis to meet the needs of the clients within their existing resources.
I would have to say that a key learning would be the tremendous barriers that individuals face with accessing healthcare for their lower limb needs. We have a complex system where services are not always integrated in a way that addresses a patient's whole health and psychosocial needs. This learning has strengthened our resolve that our clinic is indeed needed to be that bridge for patients, to support their care needs and follow them through their healing journey.
I can think of one patient that was sent from the ER to the clinical pathway. She had a large diabetic foot ulcer resulting from trauma from her shoes. Throughout the pathway, she was connected to wound care, diabetes education. She received orthopedic shoes to avoid any future trauma. And she also received very close monitoring of her wound for infection. After a few months in the pathway, she had complete healing of her wound where it closed. And she also didn't have to revisit the ER throughout this time frame.